ADHD family, welcome to another episode of ADHD Love Parent Talk. I am very excited to have my guest. Is it Chaquita?
Chaquita.
Yes. So I'm very excited to have her here. We are going to be digging into a little bit of topics around the school system. So we're going to talk about the 504, and then we're going to talk about the IEP. So as always, I try to bring you topics surrounding ADHD, and so that way you have tools in your toolbox that you can pull out as you're going through your particular journey. So Chaquita, thank you for coming. Welcome.
Thank you. I appreciate you having me.
So tell the audience a little bit about yourself and what do you do?
Okay, so I'm a board licensed school psychologist.
Okay.
So that's what I do. I've been doing it for about 8 years. I guess I can add a 9 years because I did, you have to do your student teaching year. I mean, that counts for me because I was doing evaluations and I was seeing students. But yeah, I've worked doing this in multiple settings. So I've done clinical work. I've worked in Montessori schools, community schools, private schools, urban settings, suburbs. So I've kind of been around the block. So I've seen the different facets of education,
Yes.
and personal. And so, yeah, that's what I do. That is my, I say I guess it was a passion I didn't know I had. And I think it was born out of, my own personal experience with like learning, or my son's difficulties with learning. And it really helped me to dig deep into like, how can I really connect the dots for parents and school teams so that they can really understand how to help children and teens like do better.
Okay, and do you do some actual coaching of parents or kids?
So I have a private practice in University Heights, Ohio, Sanctuary Wellness and Education. I am really big on education. I am resourceful by nature, and so I always figure things out. And I started to see when I would, communicate during my team meetings, talking to parents about different strategies that could help their child learn better or, kind of get over some of these hurdles that they were having. They would come back and they would say, man, I tried that one thing and it really worked, or, you really explained that to me in a way. And so I think my particular I guess special way that I work with parents is that I'm really big on psychoeducation. So specifically around ADHD and executive function and skill deficits, there's a big gap. So there's a gap in understanding how the diagnosis and the symptoms manifest, how it impacts learning. But even parents are like, I'm getting frustrated because of this, or, why aren't they picking things up? And so I go through a process where I teach them like, these are some of the things that you would expect because it's a developmental diagnosis. Like it impacts a child's ability to develop in certain areas, and that's going to inevitably impact learning. And so I really help walk the parents through like what that looks like in the classroom. What are some things that they can adjust in terms of like parenting practices, routines, getting them connected into like things within the community supports, but also how to navigate the school environment in a way that they can become allies and not, fighting against the school. So that is one part of how I work with families, but then I also do therapy and I do counseling with children and teens around some of the symptoms. And, like working with children who are diagnosed with ADHD, there's a lot of residual social emotional difficulties, or can be. And then also just helping them kind of navigate some of the typical like teenage stuff on top of, having
their ADHD, right?
Yep. So
that makes perfect sense. So tell me, why did you pick the ADHD realm or executive functioning realm? Was it because of your son or how you're interacting with him, or was there another reason?
So that was primarily like what really got me into like looking at, well, there's two things. So I did clinical work, and I really enjoyed, like I would build relationships with a lot of the students. And so that was really hands-on. It was different from a typical school psych role where we're doing a lot of testing, we're doing a lot of consultation with teachers. This was more clinical in nature. And so I was working with students who were on the more severe end.
Okay.
They were comorbid with maybe ODD or conduct disorder or even, you know, severe anxiety, depression. So there was a lot going on with the students. And I don't know, like I really enjoyed like working with some of the students who had ADHD because, and this sounds horrible, but sometimes like they were the kids who would wear the staff out. And I was like, no, like I want to try, you know, like I want to try to make a connection. And I remember building a really good relationship with one of the students. And I was helping them to kind of navigate, like, you know, let's not lean on this. Like you have strengths, and in this, there are some strengths. Like, how can you use these strengths? Like he was, you know, very like athletic. He was very much of a leader, and I really tried to nurture. And I don't know, I loved it. And then also on top of that, like my son having difficulties with executive function, that's what really kind of started be digging into that and really trying to understand. And so I saw that there was a connection and it just made sense to me. I was like, oh, so this is the gap. This is the thing that I can kind of really, you know, go on a rabbit hole in and help people understand how that impacts the school. Like, I mean, I don't know, schools are tough, but then when you have other things, like it can be rough. And I know how much learning means to me and how important it was. And so to have children that were struggling with learning and, you know, didn't have that same like experience with school, I wanted to kind of intervene and do my part to help. So.
No, that's great. You know, I mean, that was kind of my biggest frustration with certain, I will say, entities that I put my children in. They just really didn't have that type of support. Either they just looked at my children as if they were just bad kids, or if they wanted to support them, they just did not physically have any type of support. They didn't have a program or any way to support them. And so I had to change school systems. I've had to change daycares and school systems, sitters, multiple times. But once I found the right school system, it makes a huge difference. School system, the right teachers, the right programs. I mean, they have sensory rooms. I mean, they help him. He meets his specialist on a daily basis. And, she helps prepare him and get him ready for, mentally for class. And then they meet 3 times a week in the afternoon. But I mean, just all of these programs and the support in the community, it made a huge difference, just a huge difference. So.
Absolutely.
Yeah. So I want to dig into, first, before we get to the IEP and 504, so you mentioned, you call it psychoeducation?
Psychoeducation.
So what is that? I haven't heard that term before.
So you're looking at how different factors impact a student or an individual's functioning, right? So when we think about psychoeducation, there's these multiple, if you have gone through the process of being tested for an IEP, the portion of the written report that's called the psychoeducational report. Okay. And so it breaks down the psychological, the cognitive, impairments, the academic skills, all of the factors that could, or not all, but a lot of the factors that could impact a child's or a teen's ability to access the curriculum. Okay. We all have some level of like different levels of functioning that impact how we show up, how we show up to our jobs, how we show up in our relationships. And so I take all of these factors and I say, okay, based on, let's look at development, let's look at, schooling, let's look at experiences, let's look at parenting, and all those together can give us an idea about, okay, what's going to be the best for this kid. Now, it's not a perfect science. It's not a perfect science, but it does give us a better idea about what can help this child or this teen access the curriculum. And so the education part is, how do I teach you about what's going on? How can I communicate that to you in a way that makes sense? Because I don't expect you to know. You haven't gone through the schooling to be a psychologist or a teacher or intervention specialist. So how can I connect those dots to help you understand how all of these things come together to impact you at this moment? So that's what that is.
That makes sense. Okay, so I want to dig into the IEP and 504. So can you just start off with the base? What is the difference between the two?
Okay, so which is interesting. And I've been doing a lot more, I guess, kind of digging into the differences. And I think it can vary. And I want to kind of preface it with that. Like, it can vary from school district to school district based on the supports, the level of staff who's there, like you said, resources, programming, knowledge and skill set. But a 504 is not covered under the IDEA, it's covered under the Disabilities Act. And so basically you're looking at a plan that will provide or address how a student learns. And so most 504s will have a accommodation and or modifications outlined within that plan. And people like to, and I think there maybe is a misconception, and again, this could be based on just how school districts handle 504s, that a 504 is less potent or less important than an IEP. An IEP is specially designed instruction. So now we're focusing on like what we're teaching. And a really good example of this is, let's say you have a second grader, and the second grader is being, he's reading or he should be reading grade level text, but that student has a difficulty with sounding out words or decoding. And so they can't perform at the second grade level because they haven't developed those skills. And so for a student who was on an IEP, maybe we would be focusing on decoding, which would be a skill that typically is developed or taught around kindergarten, first grade, with the understanding that by second grade, you should be able to read some text without a lot of like stop and go and building fluency. So it really focuses on IEP, focuses more on what we're teaching and how we're going to deliver that service. It looks at even just the area. So like the areas, like, are we going to be in a resource room? Are we going to do push in? And so that is a difference. But I want to kind of dig into this because I think this is a big question that I see. Which one should I ask for?
Right.
Right. So
Exactly.
in terms of, I always try to reverse engineer. What is the barrier? Is the barrier that they don't have the skills and we need to teach the skills? Is the barrier that they have the skills, but in this environment, they're not able to practice them, or it's more difficult for those skills to be, pronounced? So that would be like looking at, okay, in a larger group for a child who struggles with or who's diagnosed with ADHD, hypersensitive to the environment. So everything is pulling them off task. Everything is important and nothing is distinguished. And so that lack of focus and ability to sustain attention is impaired. So a change to setting, they may have the skills. He might be reading on grade level if in a small group. And so we have to kind of tease out like, what is the barrier here, and work backwards from there.
Okay. So how does someone prepare the information needed to ask for a 504 or IEP? I mean, what should they bring to the table?
Okay, so one thing that I recommend, and this is kind of something that when I do like advocacy work with parents, I tell them to dig up all the information you have. Okay, we're not just looking at report cards, we're looking at how are they doing on standardized assessments? How are, is there difficulty with discipline? So looking at discipline referrals, and that's things that you can ask the school for. You can go and you can say, hey, like I need an outline, or I need a printout of like discipline records. You also want to be looking at trends, like you want to have information. Did your child go to preschool? What were difficulties that you experienced in preschool? So you're almost creating a timeline for the school to say, this is an issue and this is how long it's been an issue and this is the level of impact, because all of those things matter. Because if we have a student who, maybe for a couple of months is struggling, is that significant or is that a time? And then we would kind of look at what was going on around the time. So I always tell parents, dig up everything, report cards. I want you to, talk to your doctor, like talk to your pediatrician. Has there been concerns? Like daycare teachers, did you remember getting calls? What kind of things, what kind of feedback were you getting? Did your child go to HIS? Or so all of these things that could impact. So again, we're looking at the whole, we're looking at the whole child to see what is the level of impact that we should be concerned about, and what is the level of how is it creating a barrier in my current educational setting. And so that's where I would start. I would start with digging up as much information about performance, functioning, and health.
Yeah, that's really good. Um, Now, I don't know how other schools work, but is it the case that it's really difficult to get an IEP? Is that the consensus across the board?
That hasn't been my experience, and I do see this come up a lot. And I think and I don't have enough data to say that this is for sure, but the times or the instances that I see that, there are difficulties, it looks like some of the children are performing maybe at grade level or beyond. So they have something what's called twice exceptional, like they struggle with ADHD, but they're also super gifted. So a lot of times schools only look at academic performance, and it's not just academics, it's social emotional functioning. Like that is a part of the education system. Like we teach children how to behave and how to act. Now, depending on the system that you're connected to, that explicit instruction may or may not be in place. There's some places where social emotional programming is embedded in the thread of the curriculum from K through 12. And in some places, it kind of stops off in elementary. And so kids are just expected to learn or know how to behave or how to function socially or behaviorally. And so I think it really depends on the system that you're connected to. What interventions they're providing, but then also the level, and I think this is probably something we don't address as much, is a level of skill. What is the skill level that we have? Do we have a clear understanding of what ADHD is and how it impacts learning, beyond just, oh, it's just hyperactivity? No, it's not just hyperactivity. It impacts the way that I think. It impacts the way that I function, the way that I make friends. Like a lot of students, that I've encountered, I always ask them like, okay, what about anxiety? Because there's some social anxiety that comes along with like knowing that I want to be in this peer group, but I'm not. I can't figure out how to put the pieces together to connect to my peers. And then, there's all different types, but I really try to challenge the way we think about what education means and understand it's not just academics.
Yeah, that makes sense. So let me ask you, I know that some parents get discouraged and just feel like it may be the teachers are not listening, the principal's not listening, people are just not listening, and they do see that their children need that support. So what would your advice be in terms of really standing their ground and advocating for their child?
Okay, I always learn to kind of err on the side of, giving people the benefit of the doubt, right? So what you would do initially, as I would call a school team, and here's how you want to communicate. You want to communicate what you're seeing. Sometimes we communicate, well, the intent. We can't assume intent on either side. We can't assume that the teacher's being, negligent, and no more than the teaching staff can assume that the parents are being negligent or not disciplining their child or things like that. So we have to really kind of come to the table almost unguarded. And that can be hard because if you've had kind of like what you were saying, a lot of parents that I've worked with, they've been in multiple school systems. So they're, understandably distrustful of what is going on in the building. And so coming and communicating like what you're seeing. Here's what I'm seeing. My kid is not able to do this, or my kid is struggling with this. Here's what I've tried. What have you tried? How has it been successful? So just being very clear and concise with communication and asking questions, which I know can be hard because it's your child. And so that tends to be a sore spot for a lot of us. We come in defensive, and I can speak from experience. Like I know we come in defensive sometimes, but trying to keep an objective view about what is actually happening, not what people's intentions are. And so starting with a team meeting. And of course, there is a chain of command, right? There's the school team, there's the principal, and then you kind of work your way up from there. But I would always, advise to start with a team meeting to communicate what you're seeing, how it is impacting your kid. And that can be on multiple fronts, grades, functioning with like socially, social, because you see your kids, sometimes kids come to school and they try to hold it together, they do their best, and then they come home and they fall apart because there's so much pressure. And so really communicating that, because all of that matters. That's all part of learning, and it impacts an individual or his kid's learning experience.
Okay. And how important is it to have a really good relationship with your child's teacher? Just really staying involved in, like you said, that communicating piece. You talked about the team, but just having sometimes that one-on-one with the teacher. How important is that?
I think it's vitally important. And I actually, it's so funny because I think maybe a couple months ago I did a training on this, and I said, sometimes we don't communicate things that are really important for our teachers to know. And I think there's a lot of, I think there's multiple reasons why that occurs. Maybe there's fear of judgment, maybe there's, they're not going to do anything, but even more commonly is that, well, the school is going to do what they're going to do anyway, so I didn't really think it was important, or not really understanding that you are a pivotal part of the school's teaching team, like that education team. You know more about your kid than anybody does. And if you can think about, you're moving grade to grade with this child. This teacher has this child for, 1 year, maybe 2 years, depending on the school model. And so thinking about like how I am the most important. I need to be at the table. I need to be able to communicate that, and do it confidently. Because I think, again, you can feel marginalized, and I can totally understand that. Which is why I really try to get parents to feel confident in asking questions, putting a pause on things if things don't make sense, not just going along with the process and signing away if you don't understand. Asking questions, and if you need to reconvene, that's okay.
So how often should they meet with the team? I mean, what is a good idea? So in other words, like for my school system, I'm usually the one to call the meetings, unless it is the, whatever they call like the mandatory renewal, so
Review.
like every 3 years we renew, but I actually like to meet a little bit more often. What do you advise parents to do in terms of how often should they meet with that team?
So if you are, so let's say, you are thinking about starting a process to either request an IEP or 504. What you want to be doing is, I would say, no less than every 4 to 6 weeks, especially if you guys have an intervention plan in place. And so sometimes before you get to a point of moving forward with testing, the team will say, hey, let's try these interventions. Let's see how these work. And then we're going to document the progress. What I would always recommend is some type of weekly monitoring or feedback system. So if you're doing an intervention, let's say you say, okay, we're going to come back to the table in 4 to 6 weeks. What does that progress look like on a weekly basis? There should be some kind of communication. It doesn't have to be face to face. It could be written, it can be an email, but there needs to be some kind of way to kind of track progress and touching back, getting back in touch with the teacher or the team. And I would say, there's language that says, oh, you have to wait 6 weeks. You don't have to wait 6 weeks, because if there's a need and the team agrees, like, we can still do interventions as we're going through the evaluation process. So I would say, staying top of mind is always important. I mean, it's always a good thing. Like, if you're a parent, you want to make sure you stay top of mind, because the teacher does have, other children in the class. However, what it is that you're targeted on or you're focused on with your child. And so I would recommend no less than, maybe every 4 to 6 weeks to touch base and just kind of see, like, how are things going.
Okay, all right. And then the other question, so I had mentioned, we do that renewal process every few years. So how, I would say, what type of advice would you give parents where they really feel like their child should continue on, for example, the IEP, and the school may say, oh, but they're doing so much better, but you want them to continue to do better. What would you recommend for parents, or what type of conversation should they have to keep them, to hopefully get them to stay on that particular program?
Well, I would always, we always want to look at what is the need for supports, right? So because a kid is doing well, that doesn't mean that they don't need it, and it doesn't mean that they do need it. And I say this because we also want to be building resiliency with our children. We don't want it to always, and some kids may always need it, right? So I'm not going to say like that there's anything wrong with that. We want to look at, like, what is your personal goal, and really have a conversation with your child about that, because sometimes we make the goals for our kids, and it's like, but I don't want that. We want something for them that they may not want, and that makes it harder for them to move towards that goal, because they're an individual. As much as we are in control of, guidance and support and parenting, they are still an individual. So bringing them into that process is super important. But I would say, you and this is so timely, because I just had this conversation with one of the school team members, last week, and I said, you know, a transition plan to slowly remove services is ideal. So if you are at a point where you see your child is able to navigate with minimal supports, maybe they're, you know, they're doing pull out for tests or quizzes and things like that, but they're able to manage because, you know, they've been taught the skills and they're finding some ways to cope and deal with the, you know, maybe the difficulty with attending or difficulty with relationships, peer and or adult. I would, you know, I would really communicate, well, what does this look like? You know, how have we been already being removing supports? And that conversation probably shouldn't happen right at that table, because we would have been talking about that for a while, right? So if we get to a 3-year reevaluation and now we're like, oh, well, he or she is fine and she doesn't need it, that conversation probably should have started the year before, when we were meeting for an IEP, to really talk about what do supports need to look like right now. Is there something that we can slowly take away and see how he or she does? But I think that would be the place, because I think it's hard to know if we just remove supports what that's going to look like, because just like we get used to, you know, certain supports and things in place environmentally, our children do too. And so sometimes it's just the, you know, like, oh, I just have somebody here. We are now able, you know, like, so having somebody here and having somebody to kind of just check in and give me that nudge, but really bringing everybody into the fold, child included. What are your thoughts about being able to navigate, like, you know, all your core classes without help? Like, what do you think is, you know, how do you think that you'd be able to handle that and really kind of see? But yeah, I think that conversation should probably take place, you know, somewhere sometime before we're at that 3-year reevaluation mark.
Yeah, that makes sense.
Mhm.
So is there anything that we didn't talk about, any other advice that you can give to the parents about the IEP or 504?
I would say, and this is again, you have to know your system, and that's why it's super important to be plugged in. You know, to be an ally with the school, but don't be afraid of a 504, because I think sometimes like, well, 504 is not as important, but you can create a very robust 504 that will help your child. There's nothing wrong with a 504 and or you know, like the 504 or the IEP. It really depends on what is the level of instruction that this child or your child needs, and being able to provide that. Because again, an IEP is something that we can't reasonably do, right? So just like you were saying, like they couldn't meet that need, and we need to provide something additional. What does that additional look like? So just always being open, you know, communicating what you are observing, and staying connected to the school is going to be the best for both you and the child.
Okay. And is there any resources that you can recommend, be it blogs, YouTube channels, books, anything out there for the parents?
So I I actually created a resource, and I'm really big. I really love Peg Dawson's work. She does a lot of work around executive function and skills, which is a lot of, you know, the skills that the children who need, all the kids need it, but I think it impacts the children who are diagnosed with ADHD more at a heightened level. But I did create a resource specifically for this, right? So the resource is it outlines. It's a guide to help co-create effective 504s and
Oh,
IEPs.
nice.
So it outlines each area of executive functioning. It shows you what that look like, that underdeveloped skill looks like in the curriculum, how it might impact reading, how it might impact writing. And then also there's recommendations for accommodations, and then also some direct instructional support. So it's a resource for parents and teens, because I've been writing reports and I've been working in school. So I started to see like, these are the things that continue to come up. And when I was doing consultations, I put all of that information into that resource.
Nice. And where can they find that?
So you can actually go. So I am on Instagram. I'm at _BFit to learn, number 2, LEARN. I'm at BFit to learn on Facebook. And then my website is BFit to learn. If you go to the first link in the bio on both my Facebook and my Instagram page, there's the first link and you can download it. It's a free resource.
Very nice. And that's where they can reach you if they have any other questions, right?
Yeah, absolutely.
Perfect. So Chaquita, thank you. This was great conversation, great information. I am so glad you joined the show. So thank you so much.
Thank you. I appreciate you having me.
All right. Well, you have a wonderful day.
You too. Take care.
Okay. Bye.
Bye.